Hi, it's Fran, your holistic hygienist here at Dr. Kaczynski's Holistic Dental Center. And I want to talk to you about something that I hear sometimes from patients. They go, I brush my teeth, I floss my teeth, I water pick my teeth, I have mouthwash. Why am I still getting cavities? I'm doing everything I'm supposed to, and I'm still getting tooth decay. Why? Well, I have some solutions and some answers actually for you that can hopefully answer that. First and foremost, it may not be your fault. I mean, if you're not brushing or flossing, I mean, okay, you're going to have to take a little responsibility on that. But if you are and you're still getting cavities, it could be your genetics. It could be from mom and dad. About 40 to 60% of risks lie somewhere in your DNA. They've done studies where they actually took they were two twins. They were raised in separate households in separate environments. They were split at birth. And they were able to go back and find out what their dental records were and what was going on in their mouth. And even though they were raised in separate environments, they had very similar aspects of what was going on in their mouth. So that could be not so much what you're doing, but what's going on in your body. Another thing is your saliva. What if you have dry mouth? If you wake up in the morning and your tongue is stuck to your palate, or if you find that you constantly need to drink a lot of water, that dry mouth can actually really contribute a lot to getting decay. Your saliva actually buffers your pH of your mouth. So if you have very low saliva flow, you're not going to have a lot of pH buffering. So any of the food and bacteria that's in the mouth, you're going to actually get a higher incident of decay because the saliva also washes away food particles. So the combination of pH of your mouth is not being buffered, so your mouth becomes very acidic. So couple acidity with the bacteria, and you just have a perfect storm where you're going to get tooth decay. So we want to make sure that you are very well hydrated and see if we can find some solutions of why you have a dry mouth. Another way that it's genetics is that when you're in utero, when you're being developed, your taste receptors are developing. And what happens is you can actually, there is such a thing literally as a sweet tooth. If you have a certain type of enzyme in your mouth or in your body, you are going to crave more sweetness, sweet foods. So you're going to have that sweet tooth. Again, coupled with the bacteria that causes tooth decay, you're going to have bigger problems than maybe the guy next door. Also, genetically, if your enamel of your teeth are misshapen, or there's this genetic thing called amelogenesis imperfecta, which is a fancy word, which means the enamel, which is the harder outer coating, is not developed correctly. So the teeth are going to be softer. So you're going to probably get tooth decay. As far as soft teeth, yeah, maybe not so much, but only if you have this particular condition. But again, it could be a genetic component of why your enamel is not developed correctly. Another thing is if your teeth are crooked, if you have misaligned teeth, that sometimes is genetic also, and there's a lot of other things we can talk about at another time why teeth become crooked. But if you have all these little nooks and crannies because teeth are overlapped, food and bacteria are sticking in there, and you're going to get cavities much quicker than somebody else. So that's another thing that we need to address. And they also did some studies where they took samples of bacteria, and they found about 149 different types of bacteria in this whole bunch of people, and 2 people never had the same exact bacteria makeup in their mouth. And they also said that even ethnicity played a factor. So again, it's genetic. So despite all your hard work, there could be some things that you are out of your control. You can control how much you're brushing, how much you're flossing, but you can't control your genetics. But what you can control is going to your dentist, coming to see Dr. G, coming to see the hygienist here at the Holistic Dental Center, because any of these factors we can recognize and we can be able to find solutions so that you don't keep getting cavities. So if we can control and get things under control when they're very small and tiny, you're not going to have big problems much later in life. So there you have it. So even though you're doing everything correct, genetics might be against you, but we're here to help boost up your immune system and be able to get those areas under control. So give us a call at 973 379-9080. I'll be happy to see you for a consultation, for a new patient exam, cleaning, holistic cleaning, and we'll be able to go over everything with you. And don't forget to subscribe to our channel because we are full of tips, tricks, and info. And if you have any comments, please leave them below. I would love to be able to answer those. And any questions or any kind of comments about what you'd like to hear next, we'd love to be able to help you.